right, you are dispatched to Weber State to a 40-year-old male unconscious at middle.
Okay. Besides my sensei.
Yes.
Okay, on my approach, I'm looking at mechanism of injury, possible nature of illness. Just the one patient at this time?
One patient.
Okay, I'm going to call for ALS back and do the nature, and we're going to hold on, do a C-spine, just because we don't know what happened. So, sir, can you come help me? I just want you to hold his head in alignment just like this, okay? Sir, can you hear me? Okay, I'm trying a trapezius pinch. Any response?
No response.
Okay, breathing. I'm hearing some snoring.
Yep. Snoring breaths.
Okay, so this time I'm going to consider an OPA, just to keep that tongue off the back of his throat. Do I have a gag reflex?
Yes.
Okay, so I'm going to try an NPA this time. Does that go in?
Yes.
Okay, so the NPA is in. The snoring has stopped. How is my breathing quality, depth?
It is at about 10 shallow.
Okay, and I'm going to put a pulse oximeter on him, and what does that tell me?
He is at 86.
Okay, I'm going to do a non-rebreather 15 liters per minute.
Copy.
Okay, and my pulse oximeter, does that help?
Yes.
How does skin color look now that I've put it on?
He is pale still and a little diaphoretic.
A little diaphoretic. Okay, so this time I'm my pulse oximeter, did that come up at all?
Yes.
Okay, and I'm going to watch for chest rise, make sure the oxygen I chose was appropriate with my 15 liters. I do have a strong, regular pulse. Cap refill is less than 2 seconds. Do I see any major bleeding at this time?
You do not.
Okay, I am going to still go down the body and make sure that like the clothing is not sucking up anything instead. So I'm just going to do a kind of a rapid scan, checking shoulders, checking for blood at this time too. But I'm also checking life threats. Check underneath the back as far as I could. Okay, sternum, ribs, abdomen, stomach, hips, anything?
Nope, no blood.
Blood.
found.
I am looking at my gloving just to make sure I don't miss anything also. Strong pulses. Sir, can you hear me? Still no response. Still good pulses in the upper extremities. I did check them. Okay, so this time I feel it's necessary we need to start transport on this patient. We're going to hurry and put on a collar before we roll our patient. I'm going to size it, check JVD, tracheal deviation, palpate the back of the neck. How's my breathing?
Still at 10.
So 10. Okay, color, is that improving at all on him?
It is.
Okay. So this time we're going to roll him. I just want you to keep his head in line with his body, okay? Just right down the middle for me. Get my board ready. Okay, and on 3 on your count.
Okay, 1, 2, 3.
Okay. I'm going to expose the back. I'm going to check for DCAT BTLS. I'm going to go right from the butt crack to the top of the neck or vice versa. Anything. Looking for step up. I'm going to check the rib cage in the back.
Okay, intact, nothing found.
Excellent. I'll put him on the backboard on your count.
Okay, 1, 2, 3.
Okay. We're going to move him up.
1, 2, 3.
Good. Okay, we're going to put spider strap him down and use the headbed on his head. I'm going to do the chest, the pelvis, above and below the knees, and then the head.
Okay, consider it done.
Excellent. Thank you for your help. Okay, at this time I want to get a full set of vitals. We're going to start with sugar.
Okay, that comes back at 40.
Okay, I'm going to call ALS at this time because all I have is glucose, but my patient's unresponsive, so I cannot use it. I'm going to call ALS and let them know that my glucose did come back at 40.
Copy.
We get another full set here. Respirations were at 20. 84 on the pulse. Sir, can you hear me?
No response.
Still no response. He still is breathing adequately. My pulse was still strong and regular. (158/92). Leave that on so I can reassess vitals. Do lung sounds.
Clear, 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 and clear. Clear.
Check pupils. Pupils were burl, kind of rolled up a little bit.
Oh,
So at this time, I'm going to call medical control, let them know what I have, that we're coming in. Makeda says Weber Rescue 1, do you copy?
Rescue 1, go ahead.
Okay, we have a 40-year-old male that was unresponsive when we arrived. No history on him at this time. There was no bystanders to get it from. He does have a sugar of 40, no injuries found at this time. ALS is en route to meet us, and we're about 5 minutes out. Do you have any questions or concerns?
Bring him in.
Okay. So at this time, I'm looking for any medical alert tags to clue me into allergies, medications, any past medical history. Nobody saw what happened on scene, so I can't get last normal intake because nobody on scene knew him, or events. We just found him unresponsive. So this time, I'd like to do a detailed physical exam. I'm going to expose, checking for DCAT, BTLS. Okay, I'm going to check the head. Okay, just checking the facial bones. Check the eyes one more time. I'm checking the ears and behind. As much as we can off this one. Check the nose. I'm checking for blood, CSF, any bruising behind them or around the eyes. Checking the mouth for any blood, any broken teeth. Check the neck, DCAT, BTLS, the neck. Checking tracheal deviation or jugular vein distension, clavicles and shoulders. Exposing, again checking DCAT, BTLS. Anything found?
Nothing found.
Okay, palpate the abdomen. And do the pelvis. I don't feel the genitalia is necessary. I'm going to check the upper and lower of the leg. Again, exposing DCAT, BTLS. Check pulses. I would have him push on my hands and see if he could feel if he was responsive. Sir, can you hear me? Still no response. How is my airway?
Airway is patent.
Excellent. Okay, again, pulses, strong and regular. I'd have him squeeze and see if he could feel me. This time, I would reassess, again, the airway. I was able to get no history. I didn't find any medical alert tags. I could keep watch on that glucose, so I can keep ALS updated when they arrive, where we're at. And I'm going to reassess vitals at this time.
Okay, consider that done. Blood pressure is 100/70. Heart rate is 120. Respirations are 18. And blood sugar is at 30.
30. So blood pressure, or the sugar is going down, but I also feel my patient is going into shock. So I'd like to put a blanket over them, keep them warm. I'm going to elevate the legs 8 to 12 inches and keep that oxygen going, keep reassessing it. If I feel it's necessary, we could upgrade our non-rebreather to a BVM based off respirations, depth, and everything. And at this time, I would just keep monitoring my patient, wait for LS to get on scene, vitals, airway, and circulation.